Good morning, good afternoon, good evening, depending on where you checked in from. My name is Ngozi Okose. I'm the president of Harvard Alumni for Mental Health, and we welcome you today. We're really happy, glad that you're able to join us despite the short notice. And let me just let you know what we do. Harvard Alumni for Mental Health was created in 2014. And it's as a nonprofit organization. But our mission is actually to organize weekly events and sometimes bi-weekly events to help lower the stigma associated with mental illness and also to facilitate access to care in our global Harvard community. We are run by volunteers. Most of us are volunteers who are driven not just by career, but by their passion and compassion towards the field of mental health. We drive our agenda from our local contexts. Harvard alumni and families and friends, we are not limiting it to alumni only, because we know for us to maintain a stable mental and emotional wellness, we are also dealing with our families and friends and people within our community, okay? So we drive our agenda from our local context, to the worldwide village. Ours is to raise awareness of mental health among our alumni and family and friends. And we seek deeper connection to increase access to mental health globally. Our aim is ultimately to support the mental health of everyone. We organize so many series. We organize advocacy series where we get some of people who have experienced issues with some form of mental health, like ADHD or OCD, when they will come to talk about their experiences and what they are doing to cope. We also care about access to healthcare, mental health care, because one of the major problems is lack of access to mental health care, especially in some countries, developing countries, and then some places where the stigma is more than others, or maybe where they are so poor that some of the people might not have enough resources to access mental health care. Okay, so we also created a network of advocates, and we call them ambassadors, and they're spread all over the world. And we use them to focus on culture, to focus on diversity, and to focus on inclusion, so that we can drive our agenda to the local communities. We want to get around the world, especially now that we know that 1 in 8 adults battle mental health challenges. We really want to make sure that we spread the word and stamp out the stigma. And we're happy you're here because we do in collaboration with many organizations. The one we're doing now is we want to talk about mental health. This month is Mental Health Month, and 10th of October was Mental Health Day. So in association with World Health Organization and other mental health bodies, we want to talk about it. And we want to talk about it from the global perspective. So we're going to reflect the 5 continents, and we are happy to have you, and we're happy to have seasoned experts who are here. Most of them are our team members, but we are also privileged to have a guest speaker from Nigeria who jumped in and wants to talk about Nigeria and Africa. So we are happy to have everybody. And I will now hand it over to our able VP, who is going to moderate this event, and then we all take it from there. Thank you and welcome again to our event.
Hi, everyone. Thank you, Ngozi, for those opening remarks. So as Ngozi said, this is the World Mental Health event. So before I start, my name is Adithi. I am the Vice President of HAMH. And we are really excited to present this, our first event of the 2023 to 2024 year. So the month of October, as many of you guys know, is World Mental Health Month. This year, the World Health Organization has put forth the proclamation that mental health is a universal human right. So everyone around the world has the right to access quality mental health care and be fully supported in their mental health journeys. As we all know, mental health is imperative for physical, spiritual, and emotional well-being. Mental health is a major determinant for one's quality of life. Currently, too many people around the world are struggling with their mental health due to structural, cultural, political, and economic barriers. In fact, as Ngozi said, 1 in 8 people around the world are living with a mental health condition, and each region around the globe is facing their own unique obstacles. That is why today we have brought together an international panel of mental health advocates to discuss mental health globally and within their respective regions. It is our hope that through this panel, we all can advance one step closer in understanding global mental health in ways we each can contribute to ensuring mental health is a universal right for all. Before starting, I'd like to acknowledge that this panel isn't representative of the entire world. We tried our best to find representatives from various regions around the world, but of course, we couldn't encompass the entirety of the globe in just 5 speakers and in 60 minutes. However, we hope we can have a thoughtful and productive conversation with the panelists we have today. And we're so grateful to each of you 5 panelists for stepping up and volunteering your time to speak with us today. Your opinions and your perspectives are super valuable, and we look forward to speaking with you. So now it's my pleasure to introduce our speakers. So the first speaker we have today is Catherine Stanley Obando. So Catherine is a journalist specializing in in-depth reporting on mental health and civil society. She's the co-founder of the media organization El Colectivo 506, a bilingual digital magazine focused on solutions journalism. There, Catherine created a permanent mental health channel and has reported on mental health in Costa Rica through the Rosalind Carter Mental Health Journalism Fellowship and the Mercury Phoenix Trust HIV/AIDS Reporting Fellowship. So thank you, Catherine, for joining us today. Our second speaker is Ezra Grace Angier. Ezra is an editor, researcher, and content strategist based in Manchester, England, and research coordinator at Harvard Alumni for Mental Health. Ezra earned their Master of Arts in Divinity from the University of Aberdeen and their Masters of Theological Studies from Harvard Divinity School, where they engaged in interdisciplinary research, crafting connections between ethics, psychology, religion, and spirituality. So thank you, Ezra, for joining us. All right, and then our next speaker is Crisel Pengamonte. So Crisel is a master's candidate in global health delivery at Harvard Medical School Department of Global Health and Social Medicine in Boston, Massachusetts. She's also the director of diversity, culture, and inclusion at Harvard Alumni for Mental Health. She was a global clinical researcher focusing on advanced epidemiology and clinical trials at Harvard Medical School postgraduate medical education. She obtained her bachelor's degree in psychology, master's in clinical psychology, and doctor of medicine from the University of Santo Tomas in Manila, Philippines. Crisel is a proud Filipino physician, educator, and mental health advocate. His research focuses on the social, political, environmental, and digital impacts on mental health among Filipino youths. And lastly, she's a perpetual learner who's thrilled to be an instrument in cultivating the learning of many, especially the Filipino youth. So thank you, Crisel, for joining us. Then we have Embry Thompson. So Embry is a 3rd-year medical student at Weill Cornell Medicine in New York City. She's also a Harvard College alumna. She currently serves as the Director of Community Services for Harvard Alumni for Mental Health. She's conducted research in improving the quality of life for women who have gynecologic cancers and is inspiring OBGYN, hoping to integrate mental health practices as a standard of maternal care. Thank you so much, Embry, for joining us. And then lastly, but definitely not least, we have Chime Asonia. Chime is a lawyer, public policy advisor, and development practitioner. Currently, he serves as the founder of Nigerian Mental Health, the country's largest multidisciplinary community of practitioners and persons with disabilities, with over 30 mental health-focused organizations working to advance policy advocacy, research, and wellness programming. His organization was central to coordinating advocacy that helped pass Nigeria's National Mental Health Act in December 2022, the country's first mental health reform post-independence. His thoughtful leadership on psychology issues are featured in Harvard Africa Policy Review, CNBC Africa, and the World Economic Forum, among others. He serves as a non-resident Millennium Fellow with the Atlantic Council, premier in Washington, D.C. think tank focused on international affairs. Earlier, he advanced the UN Global Millennium Goals as an associate for the Office of the Senior Specialist Assistant to the President of Nigeria. He received a Bachelor of Arts in Political Science and Philosophy from the University of Illinois at Urbana-Champaign. He's also a Juris Doctor from Northwestern University, Pritzker School of Law. So thank you, and thank you for joining us on such short notice as well, Chime. All right, so those are our 5 panelists. We are really, really excited to have such amazing, talented, well-knowledge people in our midst. So we are going to start with this discussion. We have some questions that we pre-prepared, and then at the end, we'll have a few minutes for question and answers. So at that time, we will ask you to type your questions in the chat as opposed to speaking them verbally. So we will start with the first question, which is more of a general question, just setting up the landscape for this discussion. So with that said, the first question is, what is the mental health landscape in your region or country? What are some of the dominant themes, concerns in the area of mental health in your region in the year 2023? So if anyone feels so inclined to start, you can. So we're really excited to hear from all of you, again, about just the general landscape of mental health in your country/region right now. Yeah, Catherine.
I'm happy to start. Can you hear me well?
Yes.
All right. So I really liked this question because it was challenging for me, because Central America, and I'm here in Costa Rica, is such a diverse region. So it's a little over 1,000 kilometers long, or about 700 miles. So I think it's a little bit longer than the United Kingdom from north to south, and it's about the distance from Boston to Detroit. But within that span, which is not that huge, we have 7 countries and a vast range of indigenous cultures and languages. We have a range of governments from pretty functional democracies to autocracies. And we have lots of resentments and divides in between these countries. So it can be very hard to sum up the mental health landscape. But as a solutions journalist, I've learned that if we want to study what's working in response to challenges, we have to kind of push beyond what seems impossible. And so I liked this question because it made me think about, all right, we have a lot of differences, but what are some shared experiences we've had with mental health? So I want to quickly mention 3. One is that the region experienced a lot of trauma in the 80s when there was widespread conflict and civil wars. And there was a really interesting article recently in the Christian Science Monitor about how the lack of mental health response to some of those events could be a contributing factor to the huge rates of violence that we're seeing in the region today. So that's one experience that we've shared that's had a big impact on mental health in the region. The second is the COVID-19 pandemic. So I don't need to say much about that because that was a globally shared experience, but it definitely laid bare some of the ways in which mental health has been ignored in the region and even in Costa Rica, which is known for its robust public health infrastructure and investment. But Costa Rica had increases in anxiety and depression during the pandemic that were well above the global increases. So I think it really opened a lot of eyes about the ways in which this topic has been left behind in the region and even in countries that have a lot of health care accomplishments in other areas. And then the third is that Central America is today in the midst of a migration crisis, which affects all of the countries in the region, which are not only sending or expelling people because of violence, but also receiving a lot of people, as in the case of Costa Rica. So that raises a lot of challenges in terms of how to treat and respond to mental health challenges of people who have been displaced and been disconnected from their resources, their networks, and any mental health care they might have received in their communities of origin. So all 3 of these, war, pandemic, and migration, are of course issues that affect the whole world. We're all kind of being touched by these, not just Central America. I think these are representative of big challenges that we have that are also if we can manage it, opportunities for learning about how we can generate a better mental health response. And there are certainly lots of people engaged in that work in the region today.
Thank you, Catherine. Anyone else would like to pop in?
Yeah, I can speak for the Philippines. There are four main achievements in the Philippines. First, we have increased access to mental health services by establishing the Medicine Access Program for mental health. We've already have second would be we've centered the voices of persons with lived experiences in mental health policies and programs, as well as we have implemented the Mental Health Act through various technical products and training programs. And lastly, we've also evaluated and implement the implementation of the Philippine Council for Mental Health strategic planning. There are three main focus in the delivery of mental health services. Specifically, we're at capacity building. So since the pandemic, for the past 3 years, it focused on training healthcare workers to aid in mental health care delivery. So they've completed already a mental health internal review board, complementary quality rights e-training to promote and protect human rights in health facilities providing mental health services, as well as we've trained ordinary from community health workers to physicians, as well as management to promote mental health psychological first aid programs. In scaling mental health services, the government has already $10 million free access to mental health medications. And lastly, monitoring and evaluation. We've developed the mental health transitional information system collaboration with the Department of Health and the National Center for Mental Health. The major concern for the Philippines, I think now and in the next years would be the impacts of climate change. If you know, Philippines is an archipelago of more than 7,000 islands, and we've been consistently for the past decade one of the most one of the countries impacted by the effects of climate change in typhoons and monsoons. So despite being the least contributor to what do you call this to carbon emissions, so this change in climate seen in the increased rise of in sea level rises, and at the same time the increased monsoons from less than 5 a year to more than 20 a year has greatly not just impacted the ecological and environmental landscape of the Philippines, but it brought also anxiety, which is climate anxiety or eco anxiety, anxiety as they term now, but still it's not part of the psychological illnesses or psychiatric illness in that manner. So it is still it is these mental health conditions can be treated and prevented, but individuals are afraid because of the stigma on mental health, as well as lack access to trained mental health practitioners and centers, and simply they are not informed that these are actual concerns, and they can be a real and valid cause for their anxieties and depressions.
Thank you, Crystal. Yeah, definitely. Thank you so much. Embry, would you like to talk about the US?
Yeah, I was gonna kind of, I know, like the next question, I feel like I have a lot more to say. In terms of like mental health landscape in the US, I think that I guess one of the things that the US is doing well is I do think that there's less stigma over time, discussing mental health issues, and being like bringing mental health to the public eye, public awareness. I think a lot of public figures are more comfortable talking about mental health issues in the US. And I think that so access to care is a little, it's more of a complex issue. I think while the US is becoming more comfortable with discussing and addressing mental health needs, there's also this issue of healthcare access in general, the cost of care, and I think that brings a whole other level of complexity to access. And I think that healthcare in general in the US is a major source of mental health distress. And yeah, I definitely want to talk a little bit more about that in this conversation.
Thank you. Yeah, no, definitely healthcare, access to healthcare is definitely a big issue. The US. Chime, would you like to talk about Nigeria?
Sure. Can you guys hear me?
Yep.
Okay, good. Thank you. Yes, I think there's a couple of things. First, in Nigeria, in terms of the mental health landscape. First, I think mental health and mental disease or mental health conditions is largely stigmatized in the country. If you look at polling, there's polling from Epi Africa and Africa Polling Institute in 2000, and it indicates that for the top 3 conceptions of what someone who has a mental health conditions is, the top, which is 70%, is someone running around naked. The second is someone talking to themselves, and the third is someone harming themselves. So the idea of what somebody who has a mental health condition is essentially somebody who may be in poverty, in the streets, et cetera, like that. And it continues kind of the colonial legacy that has really hampered thoughts around mental health in the country. If you trace mental health, like the regulatory regime, it actually has colonial roots. Our legal regime back in 1918, it started as our first mental health policy started as a British colonial ordinance, and then it extended to 1958 and was codified into law, something called the 1958 Lunacy Act. And that was essentially the governing body. So when you think of, obviously, that kind of pejorative conception with somebody who has a mental health was actually codified into law as the Lunacy Act. And so I see some individuals, for instance, Dare here, who has been part of the individuals working at our network, Nigerian Mental Health, his organization's Anti-Suicide and Depression Squad, working to try to get a new regulatory regime for mental health in the country. So they say that law is a kind of an expression of public's perceptions. That was codified in law, and late last year, we were able to get that changed. So the first is that it's stigmatized. The second is that there's a really huge challenge when it comes to human, in terms of data. So, and this, I think that it's strange because there's not a lot of, there's a big dichotomous challenge when it comes to scientific production on the continent in relation to public health in other sectors. So that's one thing, but one of the most cited authors on the continent and in Nigeria is actually in mental health. And unfortunately, there's a lot of misinformation around mental health. I have conversations where I'm talking to the Ministry of Health, I'm talking to individuals who are heads of professional associations, and we're quoting inadequate data because it's not nationally representative and it's not from authoritative sources. So the most cited authoritative source right now in terms of nationally representative cycle is from 2004. Now, if you check your calendars right now, we're in 2023. So that means that the data we're quoting is 2 decades old. That is nationally representative from the World Health Organization, and it indicates things like 1 in 8 Nigerians will have a mental health condition throughout their lifetime, and only 10% have access to care, which models a lot of the access challenges when it comes to low and middle income countries. And the disproportionate burden of those who have mental health conditions and even the suicide rates are in low middle income countries. So it's strange because when we think about mental health in general, a lot of people think it's a quote unquote first world problem or global north problem, or however you want to describe it, higher income countries. But a lot of this challenge preponderance is in low and middle income countries like Nigeria. So there's a data challenge. The third is that there's a human capacity challenge. And this is exacerbated by things that you guys are already aware of. whether it's the macroeconomic conditions, whether it's the Russia-Ukraine war, or now what's going on in Israel, and that putting inflationary pressures on the naira, things like the elections that just occurred. There's a lot of brain drain because if you're a doctor or any medical profession, you get paid way more if you're in the West. We have a population around 200 million people. And based on who you talk to, we only have around 300 licensed psychiatrists. And if you actually talk to other organizations like the National Association of Psychologists, they'll say it's around 300 as well. And if you talk to them right now, they'll say it's less. It's less than that. So think about that. That's anywhere between one psychiatrist to 700,000 individuals. And if you look at international best practices, it should really be around 1 to 10,000. So we're many, many multiples in terms of what we should be. I already talked about the issues in terms of the disease, chronic disease burden. But I'll just mention two more things real quick. We also have other regulatory challenges. So I mentioned the Mental Health Act. That was a huge burden for a very long time, but we're still not finished when it comes to regulatory outputs. The World Health Organization indicates that if you want people to seek help for their friends or their families and things like that, we shouldn't have suicide being criminalized. And right now in Nigeria, it's criminalized with a 1-year jail sentence. So that's in the criminal and penal code. That might seem strange to you. What is the criminal penal code? In Nigeria, because of the North and South divisions, mostly kind of stereotypically Northern Muslim community, and in the South is Southern, there's two different criminal codes because of things like Sharia law and things like that. In both of them, it's illegal. So it doesn't really matter where you are in the country, it is illegal. And because of that, people don't want to seek help for their mental health condition. They don't want to talk to their friends and family. And when we have a mental health act that's just been passed that's supposed to support those who are psychologically vulnerable, then we shouldn't have other regulatory challenges that prevents them from getting help or prevents officials from collecting data because it's criminalized. They want to misclassify it. So we don't understand the burden, the challenge, and it harms us from putting the necessary resources in it. So there's a lot to do, but we're making some reforms and efforts. The one silver lining I would say is that a mental health program was established last year. And because of that mental health program being established last year, that's one of the things that have given a lot of wins to the sails of things like the regulatory reforms. And I would say right now we are going to the largest, kind of the longest large-scale reforms in the country in context of mental health because of the Mental Health Act passed and this new program but there needs to be a lot more done in order to get individuals the help they need.
Thank you so much for that. That was definitely I also want to address the work that you're doing. And I know you've just accomplished so much in the mental health sphere in Nigeria. So I'd like to thank you for that as well. A lot of this would not have been able to happen without your work and your countless commitments. So yeah, thank you so much. And then last but not least, Ezra, would you like to discuss the mental health landscape in the UK?
Yep, sure. Can you hear me okay?
Yep.
Great. So in the UK right now, I think I can kind of speak to 3 main challenges. The first is really around demand and the capacity of the NHS, which is the National Health Service here in the UK. And despite that being free at point of access, there is simply not enough care provision to go around, and that is resulting in exceedingly long waiting times, sometimes of 2 to 3 years, for even children and young people to be seen by a mental health professional. And that, combined with the second challenge, which is that we're seeing dramatic increases in mental health, poor mental health following and during as well the COVID-19 pandemic, which the NHS is simply unable to kind of keep up with. And then the third challenge, which really ties into there being a real lack of agency for folks navigating that system, and that is disproportionately affecting certain groups within the population, including LGBTQIA people, Black and Black British people, those who are homeless or navigating the criminal justice system. These groups are way more likely to experience detention. They're way more likely to be navigating the system as someone who doesn't have much choice about the care that they are receiving. And so there is a lot of campaigning going on at the moment to reform the Mental Health Act, to kind of provide an increase in agency and choice for those within the system, to decrease the reliance on the restraints of mental health people and the detention of mental health people, and to really address those inequalities in care that are still there within a system that supposedly provides free healthcare for all. And what we're experiencing is that is sadly not the case.
Thank you. Thank you. Yeah, definitely. That leads us into our next question, which is, what is one of the most concerning issues? So a lot of you guys touched upon, like 3 major ones, etc. So if you were to choose just one that you'd like to talk about right now, what is one of the most concerning issues that impact the mental health and emotional well-being of the people in your country / region? And of course, we can't solve any issues in this 60 minutes alone, but how do we address, in terms of just initial thoughts, and in terms of the work that you all do, how do we address them, or what are some thoughts about how we go about taking these initial steps to addressing these issues? So,
well, I kind of have a tangential answer, which is just listening to everyone's comments. It really strikes me how, and again, I'm not a mental health professional or policymaker. I'm a journalist, so I'm sure I know for a fact there are tons of conversations and alliances and international connections going on that I'm not privy to, but it just really strikes me how there's so much in common between countries that we might not always associate, or that aren't always in contact. There are the issues around the climate crisis that Chriselle spoke about. We feel them so much here, and then at the same time, the wait time within the NHS. That's really aligned with what Costa Rica is dealing with in terms of having a well-established public healthcare system where our wait time for a psychological appointment it starts at 6 months. And then, of course, there were so many things in Nigeria that are really interesting. Costa Rica, it just approved its first mental health law, so it just fills me with questions about everything that's happening in Nigeria and how that might relate to what's going on here. So I think the biggest challenge that I'm seeing right now is immigration, which I mentioned earlier, so I don't have to say much more about that. But I just think that the situation here is that the public system does not have the resources. It just doesn't, and it's not going to happen in the near future. So that's where, to me, from what I'm seeing as a journalist, what's really interesting is, where are there other actors such as nonprofits that are filling that gap, but also that are working with the public authorities on those responses? Because of course nonprofits can go off and fill that gap and just work in isolation, and a lot of times that happens. But I think there are really interesting things that happen when the government just can't deal with it. Private entities step forward, but there's a connection there.
Thank you, Catherine. Yeah, it's really, after hearing all of you guys speak about the different issues within each of your respective countries, it's definitely very mind-opening to see all the different similarities and overlapping areas of need and concern. And I think, as of course, World Mental Health Month is this month, and with the World Health Organization, the UN, etc., I think mental health is emerging as a more important issue. So it's really interesting to see how different countries are moving forward, and how there's a lot of overlap in the different initiatives, as well as concerns and holes in the system. So yeah, does anyone else have something they would like to mention in terms of a major concern they have in their respective region, country?
Yeah, I just like to continue with my initial conversation with climate change and its impact on mental health. Well, in the Philippines, or like generally across the globe, the impact of climate change in human health, we should acknowledge that, and mental health issues should be included as well. For the Philippines, we've been cited as specifically the youths aged 18 to 24 years old are as the most climate anxious in the world. And we can see the climate change related global environmental threats in deforestation, in loss of diversities, in overfishing, and those instances is related to the increased and repeated exposure to climate-related disasters. The Philippines and most of its community, as well as in most of Southeast Asia, is normally they do not have access to basic needs such as clean water, electricity, proper sanitation, as simple as like a toilet, more so healthcare providers and institutions. So I think one or things that we can help younger people or younger persons is that we have to validate their concerns. We have to acknowledge that their anxiety brought about not just the uncertainty and loss of characterized climate anxiety. On the individual level, we have to acknowledge their existential worries and fears about the future, especially the impacts on climate change on the world, like in their environment and in the future. As well as, it also touches issues on displacement, on migration, and food insecurities.
Thank you so much, Crystal. Yeah, I think it's really important to highlight the role of climate change in this mental health crisis. And along with climate change and different wars that are occurring around the world, et cetera, like a lot of these global issues are intertwined with mental health, and we can't address mental health without addressing other issues. So it's a very much interdisciplinary field, which is why it's important to consider these larger issues as well, especially when we're thinking about global mental health and health equity, et cetera. Yeah, so thank you. Anyone else like to touch upon this question?
Yeah, I definitely like to speak about like some of the issues facing the U.S., which I think two of the major ones, and maybe that's because of like because of my spaces and identities that I think of these as like the major issues, but definitely cost of living, which would include access to healthcare and mental health care as well. And I also think that like racial tension and how the government in the US addresses those issues, especially with some of the recent political turmoil and repealing of certain laws that were enacted many years ago, things such as like affirmative action, and also like I think it was within the same 2 days, like affirmative action was repealed, and also like within the LGBT community, it was determined that like businesses could basically discriminate against patrons and decide like whether or not they want to service them based on their like sexual identity. And also like laws concerning abortion rights. So there are a lot of different spheres in which the government directly plays a hand in what access Americans have to basic needs. And if we're thinking of like, Maslow's hierarchy of needs, with like your physiologic needs at the very bottom, and then, like safety being second, so many people, I think, in this country, although this is seen as a very wealthy country, a very privileged and resourced country, a lot of people are lacking those bare basic needs. And especially in the sphere of safety, obviously, like I think, when George Floyd's death happened, and that sent like ripples throughout the world, it definitely sends a message about, I think, within the Black community, mental health regarding just safety, walking outside, the people who are, enlisted to protect you being the ones who harm you, and that being like the police force or the government itself. And so there's always this baseline of anxiety, baseline of fear, simply stepping outside. And that has rippling effects on, you know, fertility and just like long-term health. There's a sociological study that was done in, I think, the 90s about how it's called the weathering effect, and how the accumulation of stressors that like Black women face makes them more fertile in their teenage years rather than like their white counterparts who are more fertile in their 20s. And that's because of the additive effects of stressors due to racial discrimination and bias. And so it's also, you know, making the women in the Black community less fertile and like not able to have healthy babies. And so yeah, I definitely think that's something that needs to be addressed, and it shows how mental health not only impacts, you know, just your mental health, it impacts your physical health, your biological health, your reproductive system, your like every organ in your body. It can be impacted by mental health. And you know, being an aspiring physician, I definitely can see that firsthand, how that plays out in hospitals. And I think all of these things are linked in the US. So you know, even the demographic makeup of mental health care providers in the US is particularly skewed. And you know, like there's a like a disproportionate number of like white psychiatrists and psychologists. And so it's difficult for people who don't fall into that racial group to find mental health care that is suitable for their needs or their specific needs, or that can help them address specific experiences that they have in their life. And so yeah, there's a laundry list of problems in the US that I think are contributing to you know, poor mental health outcomes. And the US consistently ranks much lower than other Western countries in happiness. And I think that's for a reason. You know, when those basic needs aren't able to be met, the people are suffering. It's, you know, what is really successful or wealthy country if the people in it aren't happy or well taken care of?
Thank you so much, Embry. Yeah, Chime.
Yeah, I think I can go next. Since you ended with happiness, let's start with happiness when it comes to Nigeria. So Nigeria, you know, Nigeria ranks lower than the United States when it comes to happiness. There's actually something called the World Happiness Index, and Nigeria ranks 95th. So we're in the bottom third of happiness, and that probably is counterintuitive based on the Nigerians you know around you in America and other things, Afropolitan. But that challenge is very stark and unique. In fact, there's a study from UNICEF that says that Nigerian adolescents feel more pressure to succeed than their parents or their elder generation. So there's a lot of stress and anxiety for those, because you see mass poverty, but then you see people blowing, quote unquote, or doing well in terms of Nigeria. So that dichotomy is very stringent. We've actually, as a network, Nigerian Mental Health, have identified 10 areas of concern for Nigeria. This is not something that I came up with. This is something that the network came up with when we were coming up with next steps for the Mental Health Act. I'm going to concentrate on 5, just so you hear some of the thoughts from the network of what we think are pressing issues. One is just to pinpoint on regulation is implementation of the Mental Health Act. So it was passed technically December 30th. 2022. We're in 2023, we're in Q4, and nothing really has happened on the Mental Health Act. There's some things on paper, but the key institutions like the Department of Mental Health, which now we're revising some of our campaign goals, because we've been informed that there are with the change of administration, Nigeria had a new election, presidential and gubernatorial elections in I believe it was February, March, and there's a new change of guard. Some of those individuals who are new change of guard are actually against creating a thing like the Department of Mental Health. And so in the law, there's supposed to be a Department of Mental Health. There's supposed to be a Mental Health Assessment Committee. There's supposed to be a mental health fund to help with financing. Those things are stalled if there's not a department that's coordinating and enforcing the law in the first place. But we've gotten calls and we've actually had conversations about renewed advocacy. So actually this happened last week, and now what we're doing is talking points to National Assembly members, to ministries, to the Attorney General's office, that includes trying to repeal, decriminalize attempted suicide, and then also establish a department and get a specific time frame. So that's one implementation of the act. The second is increasing mental health budgeting. If you think about the right to health, right, you think about social, physical, and mental health. So 1/3, quote unquote, if you want to think of it like that, is focused on mental. But if you look at that as a percentage of the budget, the health budget in Nigeria, it is 2.9%. The mental health budget, I'm going to repeat that, is 2.9% of the entire health budget in Nigeria. And it's fluctuated between 3 and 5% if you look at different studies. So we vastly do not finance mental health in the country. The fourth and fifth, I'm going to the third, I'm going to kind of combine. It's nothing about us without us, and inclusion of diverse actors. One of the challenges, lived experience has been mentioned, but lived experience is not a something that's elevated here, or diverse actors. And when I say diverse actors is that for a very long time, the mental health space in Nigeria has been dominated by psychiatrists. Nothing wrong with psychiatrists. I love psychiatrists. I'm sure a lot of people here are psychiatrists, but we know that psychiatry is not the only field involved in mental health. You have psychiatric nurses, you have medical social workers, you have lay counselors, you have occupational therapists, you have pharmacists, you have human rights activists, et cetera, like that. So there's a lot of hosts of actors. So the problem is not including those voice voices. We could not champion our strengths and really amplify our collective causes. And even in this actually perpetuated itself in legislation. If you look at the legislation right now, it only mentions psychiatrists, for instance. There's an independent psychological bill that we're trying to figure out what's good, and that should have been mainstreamed in the Mental Health Act. But because it's dichotomous, one has gone and one hasn't gone. This has also perpetuated itself in meetings. I've been in conversations where people have said, oh, the experts in the room are just a psychiatrist. Everybody should kind of stand back when we're dealing with things like suicide prevention frameworks and things like that. And I'm the antagonistic one and says, no, you have to elevate other voices. And so it's really important that we keep this coalition, not only because it has more impact, but because we have more well-rounded conversations and more robust discussions about what mental health policy should look like in the country. We need to mainstream psychological support, which is the fourth one. 99% of the funding that goes to mental health in the country goes to doctors and hospitals. And like I said, there's nothing wrong with that, but we know there's all areas of psychosocial support, whether it's radio, whether it's drama, whether it's support groups, things like that, right? Shouldn't just go to things like salaries and drugs. We need to think about mental health a lot more holistically. We don't do it in the country, and that's one of the things that in the context of budgeting that you see. And then finally, and this is kind of key, the one huge challenge is that mental health, we know, impacts everyone, especially those at the grassroots. And so we need to make sure that we mainstream the provision of mental health to the community, to the grassroots, and things like that. The Mental Health Act has a provision for that. It's supposed to mainstream mental health in primary health care centers. That's another thing that can't happen if we don't have a department to help mainstream those things, come up with the guidance, come up with the accreditation schemes, identify the capacity and things like that. So we need to get mental health to the grassroots. It's not just an urban problem. People are challenged everywhere in the country.
Thank you so much. Thank you. Yeah, and looking at the time, we have 5 more minutes left. So I would just like to quickly ask the last question. So we discussed a lot of the concerns and issues and areas of growth for our respective countries. But when we were planning this event, we wanted to end on a positive note. So there's been a lot of progress that has been done. And of course, it's a long way we all have to go to achieve these goals. But for the last question, we were just wondering if I can ask you, like, what gives you hope for mental health in your country? And if you could offer a message of support to those who are struggling with their mental health in your respective country or just around the world, what would it be? So not all of you again have to answer, but if you feel comfortable answering, that would be great.
I can get us started. So one thing that gives me a lot of hope for mental health in the UK and beyond is that this increasing dialogue around mental health as something that everybody has, just like we all have physical health, we all have mental health. We all have emotional well-being to consider, and kind of a move away from this emphasis on mental disorder or mental illness, which just is helping with the stigma. If mental health is something that everybody has, it is far harder to stigmatize that. And I think we're seeing also the increase in kind of community-oriented, grassroots, third-party kind of mental health support that anybody can access, and that doesn't have to be accessed through a doctor's referral or a long waiting list or through paying for private care when the NHS isn't providing. And that, that gives me a lot of hope. And so I would say to kind of anybody in the UK who is stuck on a waiting list or who feels that there's no help available or like mental health isn't being prioritized in their area, stick with it. There are people who care. There are people in your community, likely, even if they're not advertising themselves particularly well, who do want to help you. And there are places that you can get support and that things will get better. There's a lot of people trying really hard to make it better.
I can go next because I was going to say something along those lines, thinking about the people who are on the wait list here in Costa Rica, and then people in other parts of the region where there isn't a wait list because there's no service coming. I mean, I think whatever you're experiencing, there's someone or some entity that has a resource for you. It's probably not everything that you need, but there's someone who has something for you. The trick is, how do we make it so that it's easier to find those people and access those services? And that's where I think, again, it's all about tightening networks like the ones that are present here on the call today, and doing what we can as the media to raise awareness about the different solutions that are out there. But I think it really is true that there are so many people who are working on this, and we just have to do what we can so that the person who's waiting and not getting the help they need can at least connect to the people who are doing part of the work. Because if we wait for our governments to have all the resources to fully address the problem the way it should be done, then it's not going to be fast enough.
Thank you so much, Catherine. And one last word for anyone?
I can go. So two things give me hope. One is the network of amazing individuals in Nigerian mental health. We're working over 30 plus organizations from professional associations. I mentioned Dare's organization, et cetera. So they give you hope. You give me hope as well. We started campaigns. So I'm actually putting in the chat, if you want to learn about our Nigerian mental health and get involved or donate, it's in the chat. You can also sign our petition. We have over 4,000 individuals who have signed it. We're trying to get to 5,000 by the end of the month, and we're going to be doing visits to the National Assembly. So you can give us hope and support that. And then finally, I think that this is really, really, really important. I think that we win the argument. That is just, I think that we win the argument about mental health conditions being an important policy priority. I think that we don't, as maybe I'm coming at this as a lawyer, and so not necessarily a public health official. I think that when you talk about mental health, I don't think that we really win the argument in public space to help increase it. But we do. The facts are on our side. If you talk about disability, mental health conditions are the leading cause of disability. Look at the World Health Organization. 1 in 6 years lived with disabilities are caused by mental health. If you talk about it in terms of disability inclusion, I don't know if I think sometimes we want to not make the connection, but we should. Over 15% of the world, or 1/6, have some sort of disability, et cetera. Those numbers are growing, and disability is a part of everyone's collective future based on time, injury, whether it's dementia and things like that. And then ableist struggle. A lot of people don't know that we don't think about things structurally. We think about things ad hocly. And so suicide kills 800,000 people globally. And I'm going to put this in perspective, folks. That is more than homicide, murder, terrorism, and war. So when you see on the TV Israel and Hamas, when you see on TV Russia, Ukraine, more people die structurally from suicide than all those things, violent deaths in general. So even as a public policy matter, we need to be thinking about things like mental health. We win the debate in terms of demographics, in terms of impact calculus, but we need to be framing it in the context of the structural violence that people are facing every day. Remember, 1 person dies of suicide every 40 seconds.
Thank you. Chriselle.
Yeah. I think the biggest challenge for everyone around the globe is that moving forward is how to navigate these intersecting forms of anxieties, from the political, environmental, economic crisis that we all face now. it is important to destigmatize and depathologize mental health and highlight that these are normal psychological responses to actual threats and slow burn crises. The question is how to cope, how to convert anxiety into an agency for definite action, concrete action, and for sustained civic participation, especially in our era of extreme political, economic, and environmental crisis. So what gives me hope is that like each of us have now right now that we provide mental health illness and mental health in general a face, a story, a voice. We break the stigma on mental health, and we help and inspire others who are facing the same challenges and improve understanding among others.
Thank you so much. Yeah, and I see the time 1:01, so I'd just like to give a big thank you to all of our speakers for joining us today. We all really benefited from your thoughts on mental health around the world and all of your work. And for our audience members, thank you so much for spending an hour of your Saturdays with us. And we'd love to know what you thought about this event. So on your screens, you probably see a survey, a quick 3-question survey that we really appreciate you filling out. And if you enjoyed our panel today, we'd love to have you become more involved with HUM. So Charlotte has added a link in the chat to our mailing list, as well as our social media platforms as well. And in fact, next week on October 26th, we have our next event, which is mental health in a workplace. And Charlotte has also included a link to register to that event in the chat as well. You can also visit our Harvard Alumni for Mental Health website. You can literally just Google Harvard Alumni for Mental Health, and the first link that pops up should be our website, and you can register via that as well. So thank you again all so much. And I know we didn't have time for questions and answers, but if you do have any questions, you can email harvardmentalhealthsig@gmail.com, which is one of the links that Charlotte has posted in the chat. You can email us, and if you have any questions for one of our speakers directly, I will make sure to pass it on to them, and they will get back to you as soon as possible. So thank you again, each and every one of you, for spending the time to have this really important discussion with us. And again, speakers, thank you so much for dedicating your time. This was a really valuable and meaningful conversation, and I myself, I learned so much. There's a lot that needs to be done, but a lot has been done. So thank you so much. And yeah, have a great rest of your mornings, afternoons, evenings, nights, wherever you are in the world. Thank you.
Yeah, thank you.
Thank
everybody.
you.